Okay, good morning, good afternoon, good evening, everyone. It is a pleasure to be here sharing our experience. As Gary mentioned, my name is María Isabela Echavarría. I am the Implementation Research Training Coordinator, and I'm here today on behalf of the Research Strengthening Capacity Unit at CIDEIM, the institution where I work. CIDEIM is an international health research and training center located in Cali, Colombia, which is also one of the regional training centers supported by TDR. So today we want to share with you our experience and results on the process of learning, appropriation, and implementation of IR training strategies in the Latin American region. So to start, I will start with a short reflection about why implementation research. Then I will share some implementation research courses and tools that we have available here in the Regional Training Center for Latin America and the Caribbean, some of the strategies that we have used to strengthen IR capacity in LAC region. And finally, I will share some examples of impact from these training activities. So to start, well, Dr. Dinesh already showed the importance of implementation research, but maybe I will, in addition, to share a couple of examples with you. So only 38% of people with multi-drug resistant TB are enrolled in treatment. And in Sub-Saharan Africa, 10 million eligible children were not able to access seasonal malaria chemoprevention in 2020. So why, if we have available treatment, affordable and effective treatment, why we cannot achieve the results that we want or the results that we expect? So implementation bottlenecks and problems are some of the answers to these questions. And implementation can be understood as putting something into practice, and it could seem simple, but the reality is that we don't do a very good job on this in healthcare. So in average, it takes us 17 years, and I will say that maybe more, to move from basic research results to actually practice and to impact health. So, and this is because research takes time. We know it's difficult to conduct. We produce a lot of evidence, but put this in the hands of the practitioners in the field to make real change is not straightforward. So implementation research is about that process on how to get this evidence out in the real world and produce a change. So recognizing this gap between research and practice and the value and importance of implementation research, since 2015, CIDEIM joined TDR's initiative to make efforts to strengthen this area of research in different regions. Thus, we participate in the development of materials for capacity building, such as the Implementation Research Massive Open Online course, or the TDR, the TDR Toolkit on Implementation Research. And simultaneously, we initiate a process of capacity building within our own institutions, whose major experience by that time was mostly focused on biomedical research. So we started this journey with 3 specific or central inputs, I will say, and recognize unmet needs to improve implementation and close the gap between research and practice. Some training tools developed by TDR, some of those we have here, the Implementation Research Massive Open Online course, a short course developed by the Ghana University on principles of implementation research. We also have some materials in ethics, in IR, different courses and training tools that we started to use in our region. And we also identified target audiences that include not only researchers, because for implementation research, as we saw in the first presentation, the integration and the collaborative work with other sectors and with implementers and decision makers is key. So with these assets, we began the development of training activities focused on 3 main strategies. The first one We seek the institutionalization and dissemination of IR training efforts in the region. Second, we promote intra-regional collaboration in Latin America and inter-regional collaboration between the different regional training centers. And we also identify opportunities for intra-institutional leveraging by integrating implementation research in ongoing research projects and articulating efforts between projects in our institution. And I'm going to tell you a little bit about the progress and results of these strategies. So in relation with the institutionalization and dissemination activities, these activities have focused on two main tools. One is the implementation research MOOC developed by TDR, and the short course, which is a face-to-face course on principles of implementation research developed by the Regional Training Center in Africa, the University of Ghana. So CIDEIM has been involved in both initiatives since 2015, when some colleagues participated in activities to develop these tools. The implementation in the region formally began in 2017, when in the case of the MOOC, we participate in the world pilot, and also we started to support the translation of the materials to Spanish. And then from 2018 to 2021, we have implemented annual sessions of this course for the Spanish community, for the Spanish speaker community. In the case of the Principles of Implementation Research short course, as part of an agreement with the University of Ghana, the School of Public Health, professors from the University of Ghana traveled to Colombia in 2017 to carry out train the trainers and trained of trainers and build capacity in CIDEIM, between our colleagues here in CIDEIM, and also between our network. In the region, we have like a network of champions and partners, key partners, and we started together this journey. And in 2017, University of Ghana came here to start, building capacity within our team. So we have a first session in Cali in 2017, and then in the same year we have an additional session in Jamaica. And in 2019, we had another course delivered by us with the accompaniment of the University of Ghana in Medellin, Colombia, in the Universidad de Antioquia, which is the postgraduate program supported by TDR that also focus on implementation research. More recently, we also continue developing some additional tools. Two new initiatives are being developed. One of them is the development of an illustration and example of implementation research applied to Latin America, specifically to Latin America, because in the MOOC, most of the examples are focused on Africa. So we are developing this example to incorporate in the MOOC. And also, we have experience as Regional Training Center. We have a lot of experience in a training program for strengthening effective project planning and evaluation for biomedical research. And now we are adapting this training program for specifically implementation research projects. So some of the outputs that we have from this training program. So as I mentioned before, we have held 4 sessions of the MOOC with a total participation of more than 3,000 participants from the region. This table shows the distribution by countries. And although Colombia and Honduras had led the numbers of participants, we have noticed that in each session we we have the participation of new countries. And for instance, in the last sessions, we have participation, increased significant participation of countries such as Panama, Dominican Republic, that are small countries in the region. I think this is good. It is important also to note that of the 3,000 participants who enrolled, 21% finish and are actually certified in the course, which is an important number because studies usually show that for this kind of open online courses, only 10% of the participants actually completed the training. So those are good news. Another additional indicators or information that I want to share is that there is a diversity both in the academic degree and in the sector where the participants are located. Here we can observe in the pie predominant participation of graduate programs such as master's program, PhD program, and also medical programs, medical degree programs. And on the other hand, we also identify that participants are not only from the academic, which was, sorry? Hola? Hello? Can you hear me? Hello?
We can hear you, Maria.
Yeah, we hear you.
Sorry,
Yeah.
I heard something, sorry. So we have important participation from other sectors, such as implementers from the health service, from health services providers, and also from the government entities. And for the short course, which is a face-to-face course, we, as I mentioned, we have delivered 3 sessions, and we have had participants from Colombia, from Honduras, Guatemala, Ecuador, and also from Jamaica. So our second strategy is an intra and interregional collaboration. Just as TDR has used the strategy of the regional training centers, at the regional level, we have identified strategic allies with similar needs that join this effort to strengthen implementation research capacities in the region. So we have strategic allies in Honduras, in Guatemala, in Ecuador, among others, who have been essential for regional outreach and impact of this program. In the same way, interregional efforts with other RTCs in the globe have been important. In particular, this is the case of IR and our alliance with the University of Ghana and also with the University of Gadjah Mada in Indonesia. So as a result of this interregional cooperation, an IR working group has been established since the beginning in 2017, when we started to building capacity first in our own team. This group worked together initially, as I mentioned, strengthening our own capacities, and then collaborating with the training program, designing strategies to expand the program to their own institutions and to the region. And we started to consolidate or to form a community of practice that has common interest and share skills, experiences, knowledge in order to advance implementation research in the region. And finally, our third strategy is the intra-institutional leveraging. So far we have seen efforts to disseminate, or I have shared with you efforts to disseminate and institutionalize the courses in the region. And here we want to share with you how these training efforts are now beginning to permeate the research projects with the institutions, within the institution, within CIDEIM, by integrating, for instance, implementation research objectives into biomedical research projects, and also just, writing or participating in grants with implementation research projects. For instance, IR objectives have been integrated in one of the biggest research programs at CIDEIM, which is the Tropical Medicine Research Center program funded by NIH. So the current program has one objective focused on implementation research. And we also have incorporated implementation research in other training initiatives, such as the Global Infectious Disease Research Training Program. This is from the Fogarty International Center. And we have also incorporated elements of implementation research, among other projects that also have these approaches of implementation research. So finally, I want to share with you how, or share some examples of the impact from these training activities. And I must start by telling you that these projects that I'm going to share have been led by researchers who were originally focused their research efforts on biomedical research, and that thanks to the involvement on some of these training programs and the understanding of implementation research, they have advanced toward more applied research studies, such as implementation research studies. So the first example is the case of Gustavo Diaz, a colleague here at CIDEIM, a researcher here at CIDEIM. He's an active member of the TB Alliance, or Alianza TB, and Inter-institutional is part of the working group also in implementation research. And he began his training in implementation research in 2017 through the MOOC and other regional TDR training activities, but also combining with some opportunities at Yale University. Since 2018, Gustavo has participated in 2 implementation research projects that seek the identification of barriers and facilitators in the process of delivery of tuberculosis contact investigation to guide interventions to improve active tuberculosis case findings. So from these studies, 2 main gaps were identified. For instance, these gaps were related to the complexity of the process. So the process of contact investigation for TB, for tuberculosis, is a complex process. And they find that in the local level, there was disarticulation of the stakeholders involved in the program, in the process. And this produced loss of information or bad quality of the data. And in addition, it was also identified a fracture between steps of the process, because there are many actors involved in the process of contact investigation, but they are not aware of the entire process. So there is not really a collaborative work, but more like fractioned work. So with this, as a result of this, the research team, developed a critical route for the tuberculosis contact investigation process. And it's very tiny here, but this is kind of a step-by-step process to share with the people that is part, with the stakeholders that is part of this process, and be sure that they all understand the entire process and the importance of each of the steps. So this guide, or these critical routes, is in process of socialization and adoption for the local health authorities here in Cali. A second example that I want to share with you is a CIDEIM project, and I need to recall that, remember that CIDEIM trajectory had been focused more on biomedical studies some years ago. For instance, studies evaluating pharmacokinetic and pharmacodynamic of leishmaniasis cutaneous treatment. But most recently, after being involved in IR training activities and strengthening our own capacity, CIDEIM has initiated IR studies, as I mentioned before, such as this. This is a pilot implementation research study funded by private sector to develop and test a mobile application for monitoring the treatment of patients with cutaneous leishmaniasis in Colombia. So the results of this study, of this pilot, were satisfactory in terms of usability and feasibility of the application, showing that the use of the app facilitates the management of patients and improve follow-up and case detection of cutaneous leishmaniasis compared with the standard process. And therefore, the project is now planning a first step of the scaling up process by testing the feasibility of the integration of this app into the local health system. So this will be the next step for this project. And finally, a third example that I want to share with you is about, this example is about Renata Mendizabal, which is one colleague and partner from Guatemala. She's member of the regional training center network and also the working group. And she began her training in implementation research in 2017 with the MOOC and presented her final course proposal. The MOOC, at the end of the MOOC, we asked participants to present a short letter of intent. And she decided to take this letter of intent and write a proposal, an actual real proposal, and participate in one of the TDR small grants, and she was funded. Her projects proposes to understand barriers and facilitators of cutaneous leishmaniasis control in Guatemala and suggest evidence-informed interventions to address the barriers. And the project was carried out in collaboration with the Ministry of Health and identified 3 main gaps: resource scarcity, treatment challenges such as insufficient treatment rates, and also identify knowledge action gaps. So from these gaps, identified, the project proposed some specific actions, and study results were published in a scientific journal, and a policy brief was produced with the specific recommendations and cultural sensitive cutaneous leishmaniasis prevention actions. And since the Ministry of Health was very, very involved in this project, so now they are in the process of incorporating some of these recommendations into practice, and is expected to be soon also in the national guidelines. So we aim, with these efforts, we aim to continue growing and sustain a community of practice, a community that started a few years ago in 2016-17 with a small management team at CIDEIM that rapidly evolved, driven by a shared learning need and inviting strategic partners to be part of this initiative, and has continued growing with new trainers and institutions interested in IR, and that have a big potential to consolidate as a community of practice made up of researchers, students, professors, implementers, and other stakeholders that share common interest of improved implementation of research results to generate, real and hopefully faster health impact. So this has been a really great journey. We are very passionate to work on this area of research, and because of that, we are also grateful with TDR and all the colleagues that have been part of these efforts.